Over 1,700 Angelenos have been vaccinated here at the Jesse Owens Park in South Central Los Angeles. I'm Michael Reel, and this is Real Urban News. This effort has been a city, state, and federal initiative.
I'm Holly Mitchell, proud to be the supervisor representing this community, the Second Supervisorial District here in the great county of Los Angeles. Over the past year, we have reconfigured stadium parking lots, schools, churches, parks, any open space that we could get our hands on to meet the need for COVID-19 testing and vaccinations. And we have worked tirelessly with community partners, some of whom you'll hear from today, to make sure that the residents of South Los have access in their own community to these critical public health services. This work has never been easy and requires an immense amount of coordination, resources, people power, and heart to get it done, and more important, to get it done right and equitably. That's what you are seeing here today, an equitable distribution of the vaccine that puts community partnerships and our most vulnerable residents at the center of the strategy. I must commend leadership and hard work of a variety of people, both public and from the nonprofit sector. The LA County Public Health Department, Barbara Ferrer is a beast. LA County Office of Emergency Services, Kevin is a beast. FEMA, the Governor's Office of Emergency Response, CAL FIRE, Community Coalition, and Charles Drew University. Thanks to their tireless efforts, we have vaccinated close to 1,500 eligible residents in less than a week.
How important is this Charles R. Drew medical mobile truck to this entire operation?
We are committed to this entire operation, and the mobile truck is a way of expanding our capacity to get people registered and to get them vaccinated. So this is an important part of what we're doing here.
Statistically, you all have seen upwards of 1,700 people receiving shots in their arm from the South Central Los Angeles community. Right. How important? Extremely
important. You know, we are demonstrating that with trusted partners, the community will come out. This community wants to be vaccinated. We run out of vaccines every day. We have 20 left today, and we will have done 420 people. It is not easy to ignore that this community wants to be vaccinated, and we have not had the access to the vaccines that we want. And so this is an effort to stop ignoring that, because it's been on our minds. You know, it's like we have a fire and we're sprinkling water all over the state, and the fire is pretty concentrated. So we're ready to continue this until we get herd immunity in South Los Angeles.
In your capacity as the Dean of the Medical School at Charles R. Drew University of Medicine and Science, when did you realize this pandemic was going to have the effect that it's had, not only on the globe, but right here in South Central Los Angeles?
You know, we knew this from the outset, because there's an old saying in the South, when America gets a cold, the black community gets pneumonia. And so we know the disparities in health are entrenched. So we knew we had to get out ahead of this, which is why we opened the testing site early on. And now we are supporting the vaccine efforts, because it is our community. And if we don't do it, it won't happen.
How long will it take for this pandemic to subside until we can say it's over?
You know, we see the light at the end of the tunnel now. We know it's not a train. We are months away from the end, but each day that we vaccinate a group of people, each day that the president fulfills the 1 million a day to even 2 million a day now, each day we get closer to that point, and we can see it. It's months away.
Literally, a week ago today, last Friday, I got a call as I was driving to an event from the Governor's Office of Emergency Services, reaching out wanting to talk about partnerships, to ask, quite frankly, the counsel of our office to help them identify community partners who could, in very short order, emphasis very short order, not only set up and be a partner to get it done, but to have the community relationships to be able to turn people out in literally 48 hours. Our Black and Latinx communities in South LA continue to be disproportionately impacted by this virus. And from my perspective, they deserve a disproportionate investment in them and this community. That's why it was very important for us to connect with the right community-based organizations that are actively engaged, trusted, and get the job done each and every time. So we reached out to Community Coalition and Charles Drew Universities, both of which have deep roots and a history of dedication to serving South Los. So I want to make it clear that both the need and the demand for the vaccine is here in South LA. And we have the community-based organizations partnering with government at multiple levels of government who can come together, partner, and get it done. This is a model that works and needs to be expanded. Federal, state, county institutes of higher education, community organizations, and community members working together with the same goal in mind to serve and save our community. I'm pleased to announce that we'll be continuing this collaboration and extending the vaccination at this park for another week. I'm pleased to bring forward Alberto Retana, again CEO of Community Coalition.
I just want to invoke the words of two incredibly important leaders in our history that said the same thing. One inspired the other, Black and Brown. And in their words, they said, "Si se puede," yes we can. And they were both organizers, our former president, Barack Obama, and Cesar Chavez. And the reason I wanted to invoke their names is because the very work that we see today, the turnout, the attention, the fact that our people are in the front of the line is because of the hard work of community organizers and outreach workers at Community Coalition and at Charles Drew University. We waited as the ones most in need of the vaccine, ready for our shot, waiting for our shot at survival, waiting for our shot at recovery, waiting for our shot at the vaccine. And we watched the news, and we saw how the wealthier, whiter communities were getting their shot. And the LA Times reported how the wealthy West Side, such as Beverly Hills, 25% of their community got their first dose. In contrast, our communities like South Los Angeles, neighboring cities such as Compton and Watts, were lower incomes, where we're Black and Brown, were only 5%. We read the paper and we learned about the slow road out. And we were wondering, when will my community get its shot? When will my mother get its shot? When will my grandmother get its shot? And much like the feeling of relief and energy one gets when the sun rises after a storm, as we have today, our lights shine bright on us when we receive the call from Supervisor Holly Mitchell asking if we could be a part of an effort to mobilize our people.
Alberto, talk about the role your organization, Community Coalition, played in getting the word out and getting people to get vaccinated here at the Jesse Owens Park.
Yeah, Community Coalition's been around for 30 years, and what we've been doing for 30 years is involving everyday residents in improving their community, education, public health, criminal justice. So we have a deep relationship with lots of our community members, and so all we did was we went back out to the folks that have been volunteering and saying, hey, we have an opportunity to sign our community up. Can we get you to help volunteer, to come on board and help us get the word out? And it's at the end of the day, as the supervisor says, it's not rocket science. We go to the people that are most valuable in terms of their voices, and those are the neighborhood residents that live in the nook and crannies of our community.
You all door knocked. You talked about that in the press conference. You all went neighbor to neighbor, door to door, letting people know that this vaccine will be available and, come get your vaccination.
That's right. We go door to door to sign people up, let them know that this is around the corner that they can be a part of. We also call people that have been involved in Community Coalition. We text people to let them know, hey, this is happening, and we do the follow-up. And we make it really easy. We say, hey, you want to do this? Sign up and we'll follow up, make sure you get the information you need.
Hashtag where the vaccine at. That's going to be my new hashtag. I'm going to try to hashtag where the vaccine at. Then you need an amazing mobile health outreach van like this. And that's where Charles Drew University came into being. And time again, they've stepped up to ensure that our community has direct access to all that we need to be healthy. They partnered with us in the LA County Department of Health Services to provide walk-up COVID testing. That was very important to me. And then we didn't have enough sites countywide. I appreciate the challenge in terms of walk-up testing, but I also appreciate the challenge communities experience sometime making appointments and being able to keep them. And so to have a walk-up testing option was very important to me and to this community, and Charles Drew stepped up and made that happen. Without further ado, let me present to you President of Charles Drew University, Dr. David Carlisle. Dr. Carlisle.
On behalf of everyone at Charles R. Drew University of Medicine and Science, our Board of Trustees, our faculty, our staff, our alumni, and especially our students, many of whom come from and still live in the community around the university, this community and others just like it, how happy we are to be here with you today in order to fight this fight against this global pandemic that is so disproportionately affecting communities of color, communities just like this one in South Los Angeles. When we got a call from Supervisor Holly Mitchell's office this weekend asking us if we could be part of this effort this week, we didn't say how hard it would be. We didn't talk about what resources we needed. We only said, of course, because our university would not be here today if it wasn't for this community. Our university was founded by this community. Our university is here for this community, and our university will be here for this community anytime this community needs us going forward. A little over a year ago, I remember the morning of December 27th, when I read a newspaper article out of Wuhan, China, that talked about an unknown pneumonia. And I remembered SARS, and I said, oh no, here we go again. I hope this isn't SARS all over again. Well, it turned out, of course, to be much, much worse, taking the lives of over 500,000 Americans and several million people around the world. And it's not over yet. For the last year, we have been in this tunnel called COVID-19, a global pandemic disproportionately impacting communities of color. Well, it's only been recently that we've seen a light at the end of that tunnel. And I just want to thank, of course, Governor Newsom and our entire team, representatives from the state of California. I want to thank the Second District Supervisor, Supervisor Holly Mitchell. Thank you very much. I think of a quote from the Reverend Dr. Martin Luther King, and that quote is just as true today as it was 50 years ago when he first mentioned it. Of all forms of injustice, inequality in health is the most shocking and inhumane. And that was 50 years ago. That is still true today. And our COVID-19 pandemic just demonstrates how true it is today. Well, today we are putting an end to that. We're taking a step in the right direction. And I just want to say again, thank you, Governor Newsom, and especially thank you to the office of our beloved Second District Supervisor, Holly Mitchell, for making this happen. I appreciate your being here. Thank you.
Dr. Carlisle, how important was this press conference today, the mission, the statement? How important?
This is a powerful statement affirming that our community institutions are here for the community to ensure that the community gets vaccinated against COVID-19.
This was a partnership of community and state and federal government. What was the impact?
There have been over 1,500 people already this week who are now vaccinated against COVID-19 who would not have been vaccinated without this collaboration. And the collaboration is only going to grow.
The university has this mobile truck out. Talk about the significance.
Well, Charles R. Drew University of Medicine and Science is a community-founded institution, and we want to be here for the community. We will be here. We have been here. And this is how we bring our resources to the community where they're so greatly needed.
You know, we're still talking about health disparities, and for people who look like you and I, there's still a little apprehension in some parts of the city. What do you want to say to African American men and women about being vaccinated?
Well, I'm part of a group called blackdoctor.org. We wrote a letter to Black America about this, about vaccine hesitancy. And basically we're saying things are not like they were in the 1950s. They're not even like they were in the 1970s when the Tuskegee experiment ended. We are here for our community. We have our community's back. And we are here to say, get the vaccine when you are offered it. Please don't say no, because that could be a life or death decision. And we're making sure that all the issues that might arise or might be concerns about the vaccine have been addressed because of the leadership of our organization and physicians like us.
How important is it that we have this vaccination site here in South Central Los Angeles, here at Jesse Owens Park?
To utilize the historic experiences. You know, community organizing isn't new, and it works. And so to be able to tap into COCO, to tap into Charles Drew University and get their experience, their staff who have the skill and know-how and reputation and respect of community members speaks volumes. There will be any number of people who will show up here because they got a text from COCO or because they recognize Charles Drew logo and they have experience and history with those community institutions. That's why it's important to be here.
What's your hope going forward with this vaccine and eradicating the pandemic?
My hope is, as the president said, that because of the additional vaccines coming online, that he thinks that all adults could be vaccinated by the end of May. And I want to make sure that as we do that, that it's people in South Los Angeles that continue to be at the front of the line in sites in their community to be able to be vaccinated. Because let's be clear, you know, we are in phase 1B of the rollout. Those are child care providers, teachers, agricultural workers, food workers. Those are people who went to work every day when government issued stay at home, be safe at home orders. They are people who are a part of the supply chain of goods and services that we all need to survive. And so we have a responsibility to make sure that we vaccinate them to increase the likelihood of their own physical health and safety as they continue to do this work on behalf of the community.